In terms of career progression within practice, and an independent like us, then realistically you'd be working towards practice management and eventually practice ownership. That can be different in multiples, where you can go into more the admin side of management, and it can also be different if you're going down the supplier route and becoming a rep or such like. But in practice, then you're looking at practice management and practice ownership.
Once qualified as a dispensing optician, it then opens up the doors to be able to go on and do other courses. So when Rachel qualifies,
there's a few options you can do. I was quite interested in doing the low vision course to help patients with low visual needs. You can also continue on and be a contact lens optician, so you just specialise in contact lenses, or you can go on and do optometry. I'm undecided at the moment. I don't know if I want to be stuck in a room or if I'd rather be out socialising all day, but you do still have time to decide on that, and you only have to do 18 months on the next course, I think.
Because there's the fast track for optometry, which when I was thinking about it when I qualified, I had to go to uni and do 3 years, whereas they've devised a fast track course now where I think it is just 18 months and you can go on and if that's what you want to do, become an optometrist.
But even just being a dispensing optician, I think, opens up so many other opportunities for you.
Yeah.
I've known people that have went to Australia and things to work in the past.
Yeah, it's a recognised qualification in other countries as well, so it really does open up many doors.
Yeah.
What opportunities are there for dispensing opticians? Well, there is a career path. It gives you the opportunity to work any place across the whole of the UK. There are opticians in every town, so it gives you the opportunity to travel with a recognised skill. And for myself, I was able to then move with my original start working in the manufacturing of it, and the sort of interest in the lenses is going to work for the world's largest lens manufacturer, and where I've been for the past 14 years. So that's probably, it will open other opportunities and develop skills with customer service, and yeah, there we go. Go be a DO.
During my time in optics, I've worked for an independent group. I started out as a pre-reg DO with them, and then when I qualified, I then moved and became a branch manager. I moved again and took on a bigger branch, and then I worked with the head office team as a buyer for all the accessories, magnifiers, solutions, things like that. Then I took on a role as an area manager, where I was responsible for 11 practices from Aberdeen North, right up as far as Wick, and then I became training manager. So I spent a lot of time in learning and development, delivering training to staff, all non-registrant staff, so receptionists, technicians, and trainee DOs. My area then increased to the whole of Scotland and Southern Ireland, so that involved some travel, which sort of ignited something in me, and I've gone on to travel much more with my role. I became an examiner for the ABDO, which is the awarding body for dispensing opticians in the United Kingdom. I trained with them and became an examiner, and I've been examining for just about 20 years. That has taken me various locations in the United Kingdom, but also overseas. I've examined in Greece, Singapore, Kuala Lumpur and India. So there's lots of scope for career progression. If you don't want to go down the academic route, you might consider perhaps management. There are management courses that you can do post-qualification. And you can also perhaps be fortunate enough to be invited to become a director of a company, whether that's a joint venture or an independent practice, such as iCare is in Shetland. I spent quite a few weeks with the guys in iCare, an amazing practice. I just can't rate them highly enough. Clinically excellent, frame choice excellent. Patients are wonderful. I think they really appreciate being able to have services delivered on the island without having to go to the mainland. And as I say, that rapport that you bring to the role and with your patients really can't be underestimated. It's really important to build up a relationship with your patients, and that's something that you can do whilst training as a dispensing optician through the blended learning route, and also then perhaps further down the line with an opportunity to become part of the management team and in time even one of the co-owners. So it really is an amazing opportunity for the guys to offer from eye care, and I think if I was maybe 20 or perhaps 30 years younger, it might be something I would consider.